Hello again, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Now is a continuation of our preparation. We already discussed what to do pre-op. Okay, so that's the pre-op. I do the intra-op, and then what is next is actually your post-op. So this is what we're going to be discussing right now. I finished your lipo, you are already in the recovery room. You're gonna be waking up from anesthesia. You can be dizzy, you can have vomiting. Okay, this is all the effect of your anesthetic. So you just wait it out until all the effect of the anesthesia is flushed out from your body. When you wake up, you're gonna be very hungry because of the long NPO, nothing per orem. Fasting ka, walang laman yung tiyan. So as I said in the earlier video, it's best if you have some sandwich or water with you so that you can actually take sips of water, kumain ka ng konti, so that actually your tummy won't crumble so much. When you wake up, okay, you're gonna be all bandaged up and you're going to be leaky. Leaky, as in like leaking. You're going to be doing what we call open drainage. Other incisions are actually open. Push at in the head. That's why there's going to be a lot of leaking. Why? Why don't I just close it? Okay. One, I prefer open drainage because your body will not absorb it anymore. This is actually just excess fluid that will actually need to flush out. So when it leaks, you just catch it with napkins. Again, literally, sanitary napkins. Okay, may napkin ka. So for example, sa elbow, you have sanitary napkins here. In the pubic area or in the lower abdomen, you have it all down here. So by gravity, when you sit up, okay, by gravity, it leaks more. So once na umupo ka sa kanya, mas marami yung leaking na mangyayari sa iyo. You will leak usually in first 2 to 3 days. Okay, in 24 to 48 hours, sometimes 72 hours, the leaking just stops. Okay, so the incisions will just close on itself. Nothing to do, just let it leak out. And just change your napkins and your dressing. And that happens. So, for example, you're first going to be on a heavy days, and later you're going to be in medium days, you're going to be in panty chills, you're going to be next on your band-aid. Okay? So, protect your incision sites with the band-aid. Okay? For those areas that are already stitched up, like for example, in the axilla and some other parts, when do you go to shower? Shower when the leaking stops. What else do you actually expect? Oh, pain. Definitely, there will be pain. The most swollen in the first 2 weeks. Worst feeling is in the first 3 to 4 days. It just feeling mo talaga parang binugbog. Okay? Bugbog feels talaga siya. Worst feeling in the first 3 to 4 days. After 3 to 4 days, feel a little bit more better. After 2 weeks, the swelling slowly goes away. You see 50% of your result on the first month. You lose another 25% on the second month and another 25% on the third month. Until your final result is on the 4th to the 6th month time. It is a process. There's going to be bruising, okay? Para pa nakita mo, parang bugbog na bugbog ka. You're swollen, you're bruised up, and then you have this weird feeling that the skin is numb, okay? Don't feel anything on the skin. But the inside is like when you get poked. So that is the time it becomes tender and sensitive. Skin is numb, but the inside is tender and sensitive. Then it becomes hard and lumpy. So you're gonna be going to the lumpy-dumpy stage. Bukol-bukol siya na matigas. Again, that's normal. You just need to be patient. It will all go away. Of course, medications help, okay? So, anti-inflammatory, your mefenamic acid, your tramadol, your antibiotics. So, the first week lang naman yun, okay? Now, they always ask me about the compression, the garments. Okay, how do they actually, or until when do they actually use the garments? Okay, the garments is very, very important. Okay, because this is where you need to do your skin redraping. The more you wear your garments, the swelling will be lessened. Didikit yung skin mo dun sa loob. So, mas maganda yung skin redraping. Please prevent dents. Okay? Please prevent that because it can be, the dents can become permanent, okay, because of the poor redraping of the skin. Others, patients, pag bumalik sila, may suot na sila na nakalangan dito, na hanggang dito na lang yung mga nabibili. Then when you bring it down, it dents here and sometimes it becomes permanent. Same with the waist. Especially for men when they wear their pants. Okay, nagde-dent yan dun sa bandang belt area. So, please, 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 prevent that. You come back, okay, so for the follow-up, you come back to the clinic around 5 to 7 days, then we remove the stitches. We just snip it off, and then you're on your own. You're actually left to heal on your own. What do we do for faster healing? There is actually what they call lymphatic drainage. Okay? So, ang problem lang natin sa lymphatic drainage is painful because it's manual extraction or manual draining of the fluid. So, it's actually quite painful. So, my alternative is actually massage ball. You know, the massage ball na ginagamit ng mga sa gym. Okay? You just roll on it on that way, and the fluids will move so that you'll actually heal faster. Okay? That is for draining of the swelling. Another one that you can actually do is definitely you need to wear your garments because the garments actually reduces the swelling and keeps the swelling down. Okay? Pansinin mo, when you remove the garments, bam, lalaki ka kagad ulit. Okay? Then when you wear it, liliit ka rin. As again, the compression brings down the swelling. Heat is one of your best friend for healing. But it has to be indirect heat. Sauna, dry sauna, and that actually feels very good. If you're at home, you can take warm showers, okay? But please do not put a hot water bag, okay? A hot water bag directly on the skin, okay? Because the skin is numb. I have patients who do that and they get burned because it's so hot, they don't actually feel it, and then they get burned, okay, from the direct heat. So make sure it's indirect heat. Okay? The incision sites where we do when we did the entry points for our lipo. Usually, ito nilareklamo. Okay? Nilareklamo siya because it's actually dark at first. Normally, it's dark. Okay? Sa lahat naman in any sugat, even insect bite gets dark. Okay? It becomes red and then it gets dark. And then stays dark for quite a while. Then eventually fades off into a white line until mawawala na siya. Just leave it. It will go away on its own. It's just a process. Okay? So, I don't know if I missed something else. If you have other questions, just message me and I will try to answer them as much as I can. To watch more videos, please click that button down there and don't forget to like, comment, and subscribe to the Fat Soccer channel. And again, this is the Fat Soccer, Dr. Claudine Roura saying, see you in our next episode. Bye-bye!